Hello, everyone. I'm Dr. Andrew Campbell, and today would like to discuss with you several aspects of testing for mycotoxins, what to do about the test, how to interpret it, how to understand it. What kind of test is it? First of all, let me explain to you what an antibody testing is, because we use antibody testing in medicine for a lot of things, hepatitis, all the different kinds. We use it for all autoimmune disorders and diseases. We use antibody testing for mycotoxins. And basically, an antibody is a protein that is produced by the immune system that binds directly, hooks in directly with very high specificity to an antigen. And then you ask, well, what is an antigen? Well, an antigen is a toxin or a foreign substance, a foreign body, something foreign to the human body, which induces an immune response and in the body, especially with the formation of antibodies. So when we have a xenobiotic, X-E-N-O-biotic, which means a foreign substance come in, that stimulates the immune system to produce antibodies against that foreign substance. So it's very highly specific. It's for that particular, it's like a key, a particular key. It only opens this particular lock for that particular substance. So if you have an antibody against Epstein-Barr, it is not an antibody, although it's a virus, it's not an antibody to, say, chickenpox virus. Separate, different. It's very specific for things. And the same goes for a mycotoxin and each different mycotoxins. In our lab, we do 12 different mycotoxins. So, and another thing about mycotoxins is that mycotoxins actually activate the immune system. And as a result of that activation, they can bind with human tissue, by adducts. And by doing that, it can trigger autoimmune diseases. That's why an antibody test for mycotoxins is much more clinically relevant than any other kind of test, especially something like, for instance, urine. Now, interestingly, there's a lot of studies about antibodies to mycotoxins in the thousands, not just a handful. A handful is this much. That's as many as I have been able to research in the medical literature about urine antibodies, because you don't really test for mycotoxins in urine. You test for metabolites. So you're looking at the metabolites of mycotoxins, whereas this is antibodies to mycotoxins, highly specific. So, and I want to answer some areas, because people will say, well, okay, so you see a patient, they're very positive for antibodies to mycotoxins, and then will these antibodies to mycotoxins fall with treatment? Yes. Yes, because there's less activation the more you treat. So with less activation of the immune system, eventually the antibodies start falling. So how long does it take? In my experience, in the over 13,000 patients with these kind of problems, molds and mycotoxins, about 4 to 6 months before they start falling. That's after you start treatment, not from the start of testing. But remember, it's important. When you start treatment, it takes 4 to 6 months. And remember one thing, because people say, well, do these react the same way as viruses or as bacteria? No, these are toxins. They're not a bacteria. They're not a virus. They're toxins. They're different. Okay. So it's not an infectious issue. It's a toxic issue. Toxins, mycotoxins specifically, can cause cancer. So does staph or strep cause cancer? No. So now let me address another issue. What if you have a compromised immune system? What if you have somebody taking corticosteroids, for example? Antibodies are going to be affected by that. 1 milligram of cortisone suppresses the immune system for 24 hours. So when you're giving high doses of cortisone, 30 milligrams, 60 milligrams, 80 milligrams, et cetera, that's going to suppress your entire immune system, and no, you're not going to respond. The same goes if you have a patient who's on chemotherapy, radiation therapy, et cetera. Don't do an antibody test of any kind on those kind of patients. Now, again, when I looked at antibody testing for mycotoxins, there was over 35,000 articles in PubMed, and I am very evidence-based. So I look at the medical literature and get facts from there. So I'm going to post on the website from my MycoLab 20 studies on antibodies and responses and treatments, et cetera, to patients actually affected by molds and mycotoxins. I have to disclose that I'm co-author on every one of those articles, sometimes lead author, sometimes co-author. And that's evidence of what I've written. If you can find anyone that's written at least 10, not 20, 10, 5 studies on urine mycotoxins, let me know, because I haven't been able to find that. So now that we've talked about that, you have a patient, you suspect, they tell you they've been exposed to molds, and molds give an inflammatory response. But wherever there's water damage, there's going to be mold growth. We know that. And wherever there's mold growth, there's going to be mycotoxins. So even if you go and say you've got a little bit of mold growth somewhere in an air conditioning duct somewhere in the house, that mold is going to be producing mycotoxins. And those people inside that structure, whether it be a workplace or it be a home, apartment, townhome, whatever, those people are going to be constantly exposed. So you get inflammation from the molds, but you get all the rest of the toxic response from the mycotoxins. This is why long time ago, well, not long time ago, but about 15, 18 years ago, a group of us us doctors that treated this and have authored studies and co-authored studies, we get together and we coined a phrase that that molds are the gun, but mycotoxins are the bullet. So you have the patient, they've been exposed, they're sick, they've got vague symptoms. I mean, it's not like a specific, if they have A, B, C, and D, they've got this. No, it's fatigue, chronic fatigue. It's patients who headaches, each one of a different nature. They're confused, they're in a fog. Short-term memory is terrible. They've got numbness and tingling, joint aches and pains. They've got gastrointestinal issues, tremors, very, very mild sometimes, but otherwise pretty strong. These kind of symptoms, and I actually have a list on the website. So these patients you suspect because probably they've been to some other doctor who says, oh yes, you've got chronic fatigue syndrome, or that other doctor said, oh yes, you have fibromyalgia. But you're a little more clever and you decide and you ask them the right questions and they respond. And then you say, aha, so this is molds and mycotoxins. that point, you examine them, and then you order the test. You get the tests back. The 12 mycotoxins you'll get in the panel from My Myco Lab, you'll get 12 IgG mycotoxins and 12 IgE mycotoxins. Remember, we have 4 immunoglobulins: immunoglobulin G, A, E, and M. The first response to any attack or foreign substance is always an IgM antibody response, which lasts approximately 3 weeks. So starts here, goes up for 3 weeks, and then starts dropping off. And here, where it drops off, picks up and goes for a long time. IgG, immunoglobulin G. So that's your M. IgM is kind of like the Marines. They're the first ones there on the beach, etc. And then comes in the Army. So IgM for about 3 weeks, then IgG. So if you have, most people don't have an IgM unless they were just recently exposed. So IgG is a much better marker for mycotoxins. The IgE, immunoglobulin E, is a response you get from an allergic reaction. Now, when we think of allergies, we think of pollen, we think of peanuts, things like this. Remember, these are the main part of an allergy is the mastocyte. So this releases inflammatory substances into our system. So a lot of people will have 1, 2, or 3, 4 at the most mycotoxins, and they may have from IgG, and they may have a few IgEs. Usually, you don't see both real strong. You'll see one, either the IgE or the IgG. Both together is highly unusual. So remember, one mold does not produce one mycotoxins. It produces a series of mycotoxins. And so say your test result comes elevated for 2 mycotoxins, moderate, and 1 or 2 others. That means that person's been exposed and they're having an immune reaction to that, an IgG response, immune reaction. So then what do? You apply the first rule of toxicology, which is get the patient away from the toxin or the toxin away from the patient. Simple rule. So in other words, nothing is going to work if that patient's home is contaminated and they still live there, or if their workplace is contaminated and they still are at that same place. So let us assume that they've moved. Okay. And now you start treatment. How are you going to treat this? There's 2 facets of treatments. One is to strengthen the immune system, okay? And that's basically by supplements. Vitamin D3, 5,000 international units. Melatonin, because it's a great neuroprotector. You've got to give them some magnesium, because magnesium is involved with several hundred enzymatic processes. I also recommend that they take, on top of these things, a good fish oil. Personally, I don't have any relationship, but I like Dr. Sinatra's fish oil. I know him personally, and he's very wants the best. He won't settle for second best. I also, you need a good probiotic. don't use lactobacillus or bifidobacterium because there's a study done at Reading, University of Reading in London showed less than 10% of lactobacilli and bifidobacterium make it through the stomach because of gastric acids. So, and then after the stomach comes bile and bile acids. So, but regardless, less than 10% survive. So use a substance, a bacteria that produces bacilli that produce spores. I like a particular one that's made by Biobotanic. Anyway, they need this. Make sure you lower their environmental exposure to other things that cause immune stimulation. And as a doctor, you will know what these are for your patient. Make sure their diet is nutritious and not full of packaged foods and God knows what, fast foods, et cetera, et cetera. I have a sheet, 3 sheets actually, of here's what to stay away from and here's what you should be eating a lot of. No sodas. Forget, all the sodas. Or as some people call it, in the old days, they used to call it soda pop. Anyway, pop. So no soft drinks, no sweet nothings, try to use honey not from a plastic bottle, little bear, but an actual honey from somebody that has hives, etc. And those are some of the guidelines. Each patient is different. Glutathione is a great thing to use, to detoxify. To detoxify the gut, I don't use binders. Never have, never will. I've always used activated charcoal. It's inexpensive and it works. The problems with binders is they bind everything, bad and good. And then if you've got other coexisting issues, it becomes a problem. And then you've got to time it right, et cetera. No, activated charcoal, it works great. I give patients an acetylcysteine NAC. It's very useful. Okay, so now the patient has gotten better. What's the first question to always ask? How do you feel? Gee, doc, I'm a little bit better now. Okay, great. 10% better, 50%, where are you? And they'll tell you. And then you go on from that and you keep going up and up. And then one day they'll say, I actually feel much better now. Okay, so, and then you, out of caution, you retest between 4 and 6 months. Now, when you have these patients and their test results for mycotoxin antibodies are elevated, remember that can trigger autoimmunity. If it does, you've got to order an autoimmune panel. For 20 years, 25 years, I worked with Dr. Vajdanis' lab, and we used to see this all the time. These patients who came back with elevated mycotoxin antibodies would develop autoimmune problems. And they'd have, I'd do an autoimmune panel, sure enough, they were elevated for this or that, et cetera. But here's the good thing about this, is that after treatment, those drop as well, because you no longer have that immune activation that I talked to you in the beginning. So they get better. I can tell you that in my practice, there were patients who came in with elevated mycotoxin antibodies, and then I checked them for autoimmune panel, and then those came in elevated, and they'd already seen other doctors. Usually they came in after having seen a whole bunch of other people, and then they come in to see me, and I look at this, and then a few months down the road, those antibodies to autoimmune panel antibodies started dropping. So that's good news because treatment works. Now, I'm going to tell you about three different cases, maybe more, but I had a doctor call me, well, not write to me, email me. He had a patient who was autistic. It was a little girl. And the mom had taken this little girl to pediatric neurologists, pediatricians, neurologists, et cetera, had tried all the different drugs, but didn't like the thought of leaving her child on a drug that affects the brain without knowing, and none of us do, how that drug is taken now is going to affect this child's brain in 20 years from now, 30 years or 10 years from now. We don't know. So she decided to quit those, and this child was she was going to run away. She ate inedible foods, inedible things, I should say. She had bouts of rage where she would bang her head against things, hit herself, et cetera, et cetera. She was very defiant, very angry at times, very difficult to control, et cetera, et cetera. So this doctor communicated with me and he says, listen, do you think it's possible that mycotoxins may play a role? I said, well, look, if you don't check, you'll always have that doubt, won't you? So why don't we check? And he did, and sure enough, she had mycotoxins. So he started treatment. And I'm talking this year. This is not years ago. This is now this year, a few months ago. A month later, the doctor sent me what the mother had reported back to him, that she was sleeping through the night, that she was actually communicating with people, that she stopped eating inedible things, that she was able to have conversations and have emotions. So of course, in 1 month, this mother was delighted with this particular doctor, we can all understand that. So that's a case of autism, and I'm going to add one more to that because it's very possible that mycotoxins have a role in autism. This was a doctor that came to see me from another city and brought his son, who was autistic. And this doctor had read some of the studies I published, and this is why he flew all the way to see me with his son. And the same story, went to all the docs, and they gave this little boy medications, and then he decided, no, that's not it was just controlling some things, but not. But he said, the reason I came to you is because one day I was there with my son, and he said that he and his wife, she had a business degree. So on Saturdays, they would go to the office and play catch up. She would catch up on the business stuff, and he would check up on his charting, et cetera, et cetera. And they always kept their son against a particular wall in a particular part of the office where they could both see him and watch him. And when he was a little baby, et cetera, and then a crib, from a crib to one of those things I call cages, but they're actually playpens, et cetera, so on and so forth. And one day they get a knock on the door. They look at each other. They're in the building that's next to the hospital with an overpass to the hospital. And they said, who could be knocking on a Saturday? So they opened the door, and there's two men there in full Tyvek suits with respirators. And they say, can we come in? We need to check a particular area for mold. The doc says, hey, there's no mold here. He says, maybe you don't understand. 3 floors above you against one wall is a sink, and it kept leaking without us knowing because it was leaking behind the wall. And on the 2 other floors above you, there's mold against this wall. And they looked, and it's the wall next to where they used to put their little boy's crib and then playpen next to you. So I told him, I said, you know, I've never heard of a case like this, but you're a doctor, so I'm willing to give a clinical trial if you wish. And since you understand that this is a trial, this is not a definite diagnosis or anything, we can try this. And I put him on this medication, antifungal, Sporanox liquid. And what happened is the mom calls me 3 weeks later and says that her child spoke to her, looked at her, and asked to eat something. They asked for something to eat. And she was absolutely stunned. She was actually sobbing on the phone because she was so elated and glad and happy and thankful, et cetera, et cetera. So anyway, about 6 months later, this little boy would play with airplanes with his dad in the backyard. And 2 years later, he was enrolled in normal school. So those are two stories. This was the one about the doctor that came to see me was from a few years back. The first story I told you was just from a few months ago. I want to tell you another doctor story. I had a doctor who flew to see me, again, flying over thousands of other doctors because he was an interventional radiologist. You know, these are the guys that look at the imaging and determine where they have to put a needle and inject something into the liver or wherever at a very precise spot. And he came to see me because he had noted he was very health conscious, organic, jogged every day, exercised, you know, didn't overdo on anything, was very careful with his diet. He was about 40, 42. And he says, and I said, well, and the first thing he noticed was he started having headaches, and he got really worried when he had bought a jar of Advil and he reached for it and it was almost empty. So he knew that something was going on. Well, there was. And the other thing he showed me is his hands. They were like this, shaking. How is he going to use needles with shaking hands like this? My goodness. So it turns out that where the room where he would read and give his report, dictate his reports, you know, he'd put the imaging up and then dictate reports. One day a technician knocks on the door. Could I come in? He says, I want to go to the door behind you because that's where we keep all the equipment and all the liquids for him. He comes out a minute later and he says, there's been a leak. It's liquids all over and there's mold growing everywhere. So that was his experience. And of course, treated him and his tremors went away. But I'm just giving you an idea of how this issue with molds and mycotoxins can affect people. It's an equal opportunity mycotoxin. Anyone can get affected. I'd like to give you a last case report. This is mom, dad, and 3 kids, all under the age of 15. Dad's a banker and mom teaches at a school. And they brought me the reports from their home, and it said, sure enough, that they had mold growing here, mold growing there, mold growing the other place. And I explained to them the first thing they've got to do in order to get better is to move out of there. And they had all the typical complaints. The kids had nosebleeds, usually an indication of Stachybotrys mold, and usually an indication that there's trichothecene mycotoxins there, one of the mycotoxins we test for at my micro lab. Well, the other part is each child had different types of reactions and complaints, and mom had different complaints than dad. And I explained to them, remember, your immune system for every person is unique and different, even if you're monozygotic twins. or dizygotic. It doesn't matter. Everybody's immune system is unique and different. It's like a fingerprint. So you're going to react differently. So they decided, okay, and whatever with their insurance company, and they moved to an apartment temporarily. And they saw me for their test results, which obviously they were positive for mycotoxin antibodies, each one of them. And mom was saying, although we moved out, one of my kids, or actually all three kids, still continue with nosebleeds. And I said, huh. So I went through and asked them, I said, did you take all your clothes with you, or leave your clothes and leave the curtains and the towels and everything where they were? Oh, we left all that. And I said, wow, okay. And then one of the kids said, but mom, we took our mattresses. Well, yeah, they had bought new mattresses because none of them were sleeping well. So about 6 weeks before they came to see me, they had purchased new mattresses, and you can imagine 5 new mattress sets is an expense. So they took the mattresses. I told them, let's do an experiment. Put your mattresses out on the balcony of this apartment you're staying at. Well, within a week, the kids didn't have any more nosebleeds. So that's a little indicator of how these mycotoxins can affect you. The more you're exposed and you continue getting exposed, you're not going to get better. So now you kind of have an idea of how these things work. Now, those are, shall we say, not your average case. A lot of times you'll just have, mother and 2 kids, or husband and wife, or just one person who lives in a home that's contaminated. And incidentally, an interesting factor is several doctors whose practice focuses, shall we say, on Lyme disease, have sent me samples of serum to test in the laboratory on their chronic Lyme patients that have not been able to improve. Sure enough, turns out their mycotoxins are positive. So I actually published an article. It's in PubMed. It just came out beginning of this month. Is it Lyme? Is it mycotoxins, or can it be both? Well, of course, it can be either one or both. Yes, you can get bitten by a tick. And yes, you don't feel good, so you stay at home, and the home happens to be moldy. So you get the mycotoxins from the mold, and you get the Borrelia from the tick bite. And you have both, or you can have just one or just the other. But in these Lyme resistant, as it's sometimes called, or chronic Lyme, depending on how you'd like to go, I've seen a number of these. I'd say about 60 to 70% of the ones I've been sent to the lab that I have serum on turn out positive for mycotoxins. Now, what happens? They get treated for mycotoxins and they start feeling better. I'll tell you a case of one, because I really had a long talk with that doctor. He had a lot of questions about antibody testing. He didn't really understand it. To him, urine testing is pretty straightforward. And then when surprise, and I sent him an article showing that ochratoxin cannot be excreted by the kidneys. Yet, whenever he did a urine mycotoxin test, always came out positive for ochratoxin. How is that possible? The medical literature said it's not. And I sent him the article. So we had a long discussion. He had a patient who had an issue with a tick bite. Sure enough, study showed it was positive. I particularly like Dr. Rajdani's lab, Immunosciences, for the tick test that he does, the Lyme test that he does, because it's the only one that's patented in the United States. Well, why not use his? Why use a different one? I'm use the best. Why not? I think that's logic. And it was positive. He treated the patient, and the patient um, uh, did well in the beginning, and then started to go decline and went into chronic or resistant Lyme. Did a thing. So I said to him, well, he asked me, he says, well, which could it have been? He came with me with fatigue. Well, what happened with this patient is he found out through testing and whatnot, that his home was moldy. So he had a trailer in part of the yard of his house. So while they were doing things with the house, he went to live in his trailer, and he had to walk from his trailer to the mailbox, get things, et cetera, et cetera. And he'd do it, basically with flip-flops. That's where he got the tick bite. So A and B. Lo and behold, he treats the patient for mycotoxins. The patient gets better. So you have to remember that just like you test Lyme and you test for co-infections, Bartonella, Babesia, Ehrlichiosis, etc. Remember, there's another part of that, which could be toxins, mycotoxins in particular. So there's actually studies in the medical literature that show that patients whose immune system is affected by Borrelia also have CMV, cytomegalovirus, EB virus, Coxsackie virus, HSV, HSV6, etc. So just want to let you know that. One last thing, because what I want to do is give everyone a chance to type in your questions, ask questions by typing them in, and I'll answer them as we go along. I think that it's important for you to know that studies have shown, studies that were done, pathology studies on the brains of patients that have died with Alzheimer's disease, 25% were found to have Lyme, Borrelia in the brain. And another group was found to have mycotoxins in the brain. So that's how it affects us. So it doesn't go away in the sense that if you're young, that's fine. But even in old age, you can develop an infection. So make sure you check younger and older people, because it can actually lead to eventually have Alzheimer's disease. And I found that article, and there's a doctor who's very well known in this area, and he's probably the world's leading expert in this, Dr. Dale Bredesen. He's a wonderful, wonderful doctor. And he wrote the book, The End of Alzheimer, and I highly recommend that you read it. It's a great, great book. It just opens up your mind and your eyes. Not only the public, but also doctors of every kind, and anyone who's interested in healthcare should read this book. So think of it that way. Remember, there is neuroborreliosis. Just in the same way, a number of studies have shown that mycotoxins affect the central and the peripheral immune system. I can tell you that a study I did with several other doctors together, we had over 100 patients, and they were all exposed in the same place. They were all in a dilapidated, if you wish, mall. I call it dilapidated, but it was in a mall, and they were working in an office at that mall, over 100 people. And they used to have to cover their printers and computers with plastic on the weekends when it rained. Can you imagine? So we found that these people had the brain affected and their peripheral nerves affected. After treatment, it went away and they were fine. But yes, they were effective. The other thing that I bring you back to the beginning of my lecture, where I told you that you can actually have how the immune system is activated by mycotoxins, and that activation can lead to autoimmunity by triggering autoimmunity, by forming adducts, binding to human tissue, forming adducts, triggering autoimmunity. MS, multiple sclerosis, is an autoimmune disease, obviously, and it affects your brain. And we've seen that too in patients with mycotoxins, and that too gets better. So I wanted to leave about 20 minutes open to answer any questions. I see there's some coming in. So let me answer some of these. How do you prescribe activated charcoal? What form, how often, etc.? How does a lay person get the blood work from your lab done? If we weren't working with an MD, should we bring a test to a lab and give the phlebotomist the instructions, etc.? Those are all good questions. So let me answer them. How do you use activated charcoal? You know, the easiest way is you get some at the wherever drugstore, because it's very commonly found, activated charcoal, and read the instructions. It'll tell you how much to take. Remember, for the public, don't overdo anything. Don't start, oh, if 1 teaspoon is good, well then 10 teaspoons must be better. No, follow the instructions. As far as doing the test, I have patients call me with, who are lay people, normal people, everyday people, call me from, well, actually send email to the lab, mymycolab.com, and you can register as a patient or as a healthcare practitioner. So you can register as a patient. We get questions all the time from lay people from all over. I mean, from the United States, Canada, the United Kingdom, Mexico, etc., and say, how do I get this test done? Well, you register and you get a kit sent to you. And this kit comes with everything you need and complete instructions. And this, you've got to find a phlebotomist. Now, maybe your doctor has a phlebotomist, or you can ask your doctor's phlebotomist, or you can, LabCorp and Quest, they're out of the question. They only do LabCorp and Quest tests. So they won't do any tests from any other place. There are independent blood draw places that you can take it to. So that's, I hope I've answered that question. And then you send the kit to the lab, and then it gets tested. Like almost every antibody lab, I'm going to tell you the standard thing, whether you call Cyrex or Immunosciences or MyMycoLab, it doesn't matter. These are antibodies. They take 15 working days to process. This is, if you want to do a SMAC 24, you know, test your liver enzymes and your this and this and this and this, whole blood, you stick it in a machine, 15 minutes later, you get a response typed out. Those are whole blood tests, they're automated. That's what Quest, LabCorp, and all those people do. These are not automated. These take a lot of technician time, very precise, and they're very specific. Okay, let me answer some more. Can I tell upon the gut microbiome and neutralizing molds in the gut, the ability of molds, such as the anaerolone, to replicate? Okay. Where is 80% of your immune system? It's in your gut. It's in the microbiome. Okay. We are made up of about 35 to 37 trillion cells. The microbiome contains 130 trillion cells. Guess who wins? We are made up of 28,000 genes. Microbiome has over 1 million. So microbiome is very important. So when you take bacilli that form spores as a probiotic, such as the one I mentioned from Biobotanical. You're going to help the bacteria that's good for you stay and get rid of the bacteria that's bad for you. That's one good thing. But when you want to get down on neutralizing, what do you need? Do you want to neutralize or do you want to get rid of? I prefer getting rid of. I don't neutralize. That means they're still there, but they're just neutral. No, I get rid of them. As an MD, I prescribe Sporanox, itraconazole, 100 milligrams BID. But say that you may be a chiropractor or a nutritionist, or et cetera. What do you do then? Well, I have a list of things that you can take orally that are not prescription drugs that also not neutralize, get rid of the stuff, the mold, and help get rid by reducing the mold, and then increasing the immune system's effectivity. Your own immune system will help get rid of the mycotoxins, and that's how you can do some of that. I hope that answered your question there. Can a person be asymptomatic and still have high mycotoxins levels while someone else in the home can be deathly sick with the same level of mycotoxins? Thank you. Yes, I tried to explain this, and I want to get into that a little more because it's a very good question. Everyone's immune system is different, okay? Everyone's immune system is unique. So, you can have one person reacting very highly and another person not reacting very highly, meaning, and I'm not talking about immune reaction, I'm talking about personal reaction, having symptoms and all this. Yeah, one person could be really overwrought and have a lot of illness and just feel terrible, and the other person's not that sick. Remember, they did a study, and I know I'm kind of going away from mycotoxins, but it's the same type of thing. If you remember, I mentioned the 5 patients, mom, dad, and the 3 kids. One of the kids was very sick, very, very sick. Dad, minor little things. The other 2 kids and the mom, medium. Okay, so you get a whole spectrum, all depending on how strong the immune system is. So yes, you can have minimal symptoms and have mycotoxins if you're being exposed. Now, let me tell you something. If you're not being exposed, if you come to see me as a patient, okay, and say to me, Dr. Campbell, I think I have mycotoxins. The first question, why do you think that? Well, is there any mold in your home? Is there any mycotoxins? No. Well, what about where you work? No. Were you exposed maybe 6 months or last year? No. No, we had everything tested. Everything's fine. How do you feel? Oh, I feel fine. I just want the test. What do you do? I usually try to discourage patients like that because I don't think they understand it or they're pursuing some other purpose. But in general, you can get 2 people, same home, living in the same home, and one has minor symptoms and the other has real bad symptoms. So yes, you can have that kind of combination. And I've seen it happen. In my lectures that I give at medical conferences, I tell people that because some they'll say, how is it possible? They're all exposed to the same thing. Oh yeah. But remember, everybody's immune system is unique and different, So you've got to have that in your mind when you see people. They're not all going to have the same reactions. So I hope you've learned. I'm going to give another webinar. This time I'm going to focus specifically on available treatment. I can't talk about specific treatment for a particular patient, but I can give you the very good treatments that work for this, for that, for the other. Remember, there's a lot of neurological issues in mycotoxins, et cetera. What to do about those? Do you need any extra help in diagnosing? Because once you get mycotoxins, but they still have this, should you order other tests? I'll give you a preview. Your patients should have serum IgA, IgG, IgE, and IgM antibodies. Not antibodies, serum levels of those immunoglobulins. And remember that IgG comes in 4 different subclasses. So just know their immune system. And these tests, Quest, LabCorp, they all do them. They're very old tests, very standard, and not expensive at all. So that's one thing you want to do with your patients, whether they have mycotoxins or whatever disease they have. You want to know how well they're going to respond to your treatment. Get a serum immunoglobulin G, A, E, and M, and the 4 subclasses for immunoglobulin G. Thank you for being on board with us, and I hope I've done a good job at answering your questions. And I'll see you in 2 or 3 weeks for our next webinar. Thanks a lot. Bye-bye, everybody. So long. See you soon. Bye-bye.
Thank you very much for attending. A recording will be sent to you within a day of the webinar. Have a good day.